So, this is my list of 5 things that people should know about a hospital laboratory as a clinical lab scientist, medical laboratory technologist, medical lab scientist, however you will, my role. And yeah, here we go. One, so depending on the hospital size, attention to detail is not the priority. The priority is to push them samples out as fast as you can. So good luck if you're wanting a very focused, detailed, and personalized experience when it comes to your laboratory technologist or the professional working on your lab tests. Two, which is kind of like janky, is that when we're calling critical results, so anything too high or too low above the normal range or below the normal range is considered critical. Sometimes your nurses or doctors or medical professionals are not available for us to deliver those criticals, which means a delay in patient care. So you can be up there suffering and need these results so that you can get treatment, but them people is not available for communication. So you just suffering. On a brighter note, hospital labs are open 24/7. So if there's a nurse, a doctor, any type of medical professional by you, there's a laboratory that actually is full of staff that's on standby to create any type of testing that needs to be done or to perform any testing that needs to be done. So they're 24/7. It's always somebody down there in the lab ready to give results. Another thing that you should know about hospital labs is that we get mistaken for nurses all the time. Yeah, we work in the laboratory. Yeah, we get paid the big bucks. Yeah, we wear scrubs, but we do not know what's going on that floor. No, we do not know about your medication. No, we do not know if you can get some food. No, we don't know what's going on up there except for your samples that are coming down to us and whatever access we have on the laboratory information system. Most of the time, we don't know what's going on. We're just there to give the results and do quality within the laboratory. All that other stuff that's going on the floors, sorry, babe, ask your nurse. And I feel like the final thing that I wanted to address is delay in testing. So this will be the 5th thing. So a delay in testing isn't technically always the technologist or the scientist's fault. Sometimes the machines can be down. When a machine is down, you can't do nothing. We is not out here eyeballing samples and telling you like, oh, your red blood cell count is low, your white blood cell count is high. Like, you got you got influenza, you got like RSV. We're not professionals like that. We use a lot of machinery, equipment, a lot of manual things. So once the machines or the equipment is down, it's gonna be real hard to get those test results. So that's like the 5th and final thing that you need to know about a hospital lab. Sometimes the machines are down and we can't do nothing, so therefore there's gonna be a delay in patient care and a delay in testing. Sorry.